Good evening, everyone, from Geneva WHO headquarters. My name is Tariq, and I'm happy to be back at these press conferences. It's been 5 months. So welcome to another WHO regular COVID-19 press briefing. We have a number of speakers here in the room, but also we will have some guests that Dr. Tedros will introduce in a moment. In a room with us, we have WHO Director General, Dr. Tedros. We have Dr. Maria Van Kerkhove, Technical Lead on COVID-19. We also have Dr. Mike Ryan, who is our Head of Emergencies. We have Dr. Mariangela Shimau, who is Assistant Director General on Access to Medicines and Health Products. We also have Ms. Dia Satyani Saminarsi, who is a Senior Advisor on Gender and Youth. Online, we have Mr. Stephen Solomon, Principal Legal Officer. We have Dr. Soumya Swaminathan, our Chief Scientist, and we have Dr. Kate O'Brien, who is the Director for Immunization, Vaccines, and Biologicals. As we always say at the beginning of these briefings, we have simultaneous interpretation in 16 languages, plus Portuguese, plus Hindi, and I would like to thank interpreters who are here with us today. With that, I'll give the floor to Dr. Tedros for his opening remarks, and also who will introduce our guest today.
Thank you, Tariq, and welcome back. Good morning, good afternoon, and good evening. This week, I was pleased to see that the United Kingdom's Medicines and Healthcare Products Regulatory Agency gave an emergency authorization for the Pfizer-BioNTech COVID-19 vaccine for rollout. Just like with the UK's finding on dexamethasone in the summer, this is an important scientific step for the world, as vaccines will be critical in the battle against COVID-19. Progress on vaccines gives us all a lift, and we can now start to see the light at the end of the tunnel. However, WHO is concerned that there is a growing perception that the pandemic is over. The truth is that at present, many places are witnessing very high transmission of the virus, which is putting enormous pressure on hospitals, intensive care units, and health workers. Some countries in Europe have managed to reduce transmission of the virus by putting stringent measures in place that limit people from mingling. As previously seen, as these measures are lifted, it's important that people should continue to follow national and local measures to ensure that cases do not rebound. Even as vaccines are rolled out, people will need to keep adhering to public health measures so that everyone is protected. We know it has been a hard year, and people are tired. But in hospitals that are running at or over capacity, it's the hardest it can possibly be. My personal ask to people is simple. Please be careful. Think of health workers and act for the greater good, because it will save lives and livelihoods. Fighting this pandemic is everybody's business, the government and every citizen. The pandemic still has a long way to run, and decisions made by leaders and citizens in the coming days will determine both the course of the virus in the short term and when this pandemic will ultimately end. With vaccines now being introduced, it's really important that they are distributed equitably around the world. Since Gavi, CEPI, and WHO set up the COVAX facility in April of this year, 189 countries and economies have backed it. WHO is engaged with our partners at all levels, working to boost manufacturing and ensure rollout of COVID-19 vaccines. A new 100-100 initiative, a major sprint by WHO, UNICEF, World Bank, Global Fund, and Gavi aims to help 100 countries conduct rapid readiness assessments and country-specific plans within 100 days for vaccines and other COVID-19 tools. First, we're asking all countries to do a country readiness assessment that takes into account cold chain, health worker capacity, micro-planning, initial target populations, and training. This will form the basis of national deployment and vaccination plans, which will outline how to roll out the COVID-19 vaccines and identify any potential bottlenecks that will need to be planned for. For decision makers, this means passing any legislation and policies needed to expedite the process, ensuring the regulatory process is fit for purpose and confirming that the financing is in place. The COVAX facility, which is the vaccine arm of the ACT Accelerator, intends to provide doses to enable the 189 countries and economies to vaccinate those at highest risk of the virus. In the first phase of the rollout, sufficient doses will be provided to cover health and social care workers. As supply increases, vaccines will be rolled out to cover 20% of the population of participating countries and economies, which will ensure further high-risk groups are covered. The payoff from this will be huge. New research by the Eurasia Group found that the economic benefits of a global equitable vaccine solution alone for just 10 high-income countries would be at least $153 billion in 2021, rising to $466 billion by 2025. COVAX has already secured 700 million doses of 3 vaccines, and next year we aim to use additional funds to ensure that at least 2 billion doses of safe and effective vaccines are available around the world. To ensure that this effort becomes a reality, the ACT Accelerator urgently requires a cash injection of $4.3 billion to fast-track critical areas of work and ensure that rapid tests, treatments, and new vaccines are distributed equitably. On equitable distribution is the right choice and the smart choice. As well as ensuring supply, manufacturing, logistics, and funds are all in place, it's important to ensure that leaders communicate with their populations about the importance of vaccination and how and where to get it. The WHO Technical Advisory Group on Behavioural Insights and Sciences for Health, which was recently established and chaired by Professor Cass Sunstein, released a report this week focused on how best to ensure high coverage of new COVID-19 vaccines. The report provides initial lessons and recommendations. However, like with everything in this pandemic, we need to learn fast and be ready to quickly adapt our strategies. To say more on how best to increase acceptance and uptake of COVID-19 vaccines, I'm joined by Professor Sunstein. Professor, you have the floor.
Thank you so much, Director General. And the Technical Advisory Group worked long and hard with WHO colleagues on this report. It reflects decades of research on vaccine acceptance and take-up. Still, this is an unprecedented and in some ways unique challenge, and there's a great deal to learn in real time. This report is the beginning, but not the last word, and there is a great need to adapt quickly to challenges, and the Technical Advisory Group, together with WHO colleagues, will be engaged in doing exactly that. With that disclaimer, there are three things that we know that should be helpful in providing a framework. The first is the essential importance of an enabling environment for vaccination. Central questions are: where are vaccination opportunities located? How long do they take? Are they time-consuming? Are they expensive? What is the quality of the experience? Are people treated with respect and kindness? And is equity part of the picture? It's clear that the essential step for increasing vaccine uptake is to ensure an enabling environment for people. The second part of the picture has to do with social norms. All over the world, vaccine uptake has been promoted by favorable norms, and sometimes it's been challenged by unfavorable ones. We know a great deal about how to promote favorable norms. Health professionals are often trusted, especially if they themselves have been vaccinated. Health professionals who are part of the local community and are understood to be connected with the identity and self-understanding of people in the relevant location, they can be extremely impactful. To highlight new or emerging norms in favor of getting vaccinated in this very challenging environment can be a productive strategy. In addition to creating an enabling environment and promoting helpful social norms, it's very important to put a spotlight on people's motivations. Motivations are an outgrowth of values, they are an outgrowth of emotions, and they are an outgrowth of information. A central way to increase motivation is to increase trust through transparency and empathy and clarity, and through meeting people where they are and listening very carefully to people's concerns and fears. An emphasis on the social benefits of getting vaccinated, not just the benefits to people who are getting vaccinated. The life you save might be your own, but also by emphasizing the benefit to people around you and in your community. The life you save may be your father's or your closest friend's grandmother. Local contexts greatly matter. We know that. One size fits only one. It doesn't fit all, which is one reason that learning from the community and engaging carefully with relevant people, leaders, and ordinary citizens is central both to promotion of widespread vaccination and to promotion of equity. We have in today's document a provisional framework, but it's important to underline the word provisional and put it in large font. It will be essential to obtain and consider new knowledge as it emerges. Thank
you. Many thanks to Professor Sunstein, who is, just to remind, a university professor at Robert Walmsley University and also chair of Technical Advisory Group. I give the floor back to Dr. Tedros.
Thank you so much, Professor. I couldn't agree more about the need to have an open dialogue with people about COVID-19 vaccines so we can ensure they're effectively rolled out. Again, thank you so much for your leadership, Professor. And it's a very important area that you're covering, and we hope it will support the vaccination program, which we hope we will be starting soon. It's important that all groups have a voice in the future of health and the planet. In this regard, today I'm announcing the launch of a WHO Youth Council, which will provide advice on key health and development issues affecting young people. COVID-19 has affected young people a great deal, including mental health. The Youth Council will serve as a platform for designing and incubating new initiatives and for maintaining and expanding existing meaningful youth engagement initiatives of WHO. It will work with organizations dealing with the broad spectrum of health issues affecting youth today. Young people aren't just the future, they are the present, and we must hear their voice and experience to build the post-pandemic world together. I thank you. Back to you, Tariq.
Many thanks, Dr. Tedros, and thanks also